Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this media briefing, which is hosted by the Johns Hopkins Bloomberg School of Public Health. Today's speakers will discuss ticks and tick-borne illnesses like Lyme disease. They'll dive deeper into why these illnesses are increasing, their symptoms and outcomes, and how people can protect themselves. The speakers will also discuss the latest research and current status of vaccine development. I'd like to briefly introduce our speakers. Nicole Baumgart is a Bloomberg Distinguished Professor of Immunology and Infectious Diseases in the Department of Molecular Microbiology and Immunology, and Director of the Lyme and Tick-Borne Diseases Research and Education Institute at the Johns Hopkins Bloomberg School of Public Health. Thomas Hart is an infectious disease microbiologist at the Lyme and Tick-Borne Diseases Research and Education Institute, an assistant professor in the Department of Molecular Microbiology and Immunology at the Johns Hopkins Bloomberg School of Public Health. We will have time for questions during this discussion. We will take some that have been submitted in advance of the briefing and some from the Zoom chat. If you have a question, please enter it in the Zoom chat addressed to panelists and hosts. Please enter your name, media outlet, and question. We hope to cover as many as possible. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. Participants will be muted during this briefing, and it will be recorded. Let's go ahead and start. Professor Baumgart, it's tick season. What is worrying you?
Yes, early signs, which are the number of emergency room visits in April, unfortunately, seems that we're in for a very bad year. And of course, these numbers are only the tip of an iceberg of all the cases of tick-borne illness that we have seen so far this year. And what we have, the only thing we have right now really to offer in terms of prevention methods are those common sense methods such as, taking a hot shower, checking yourself from ticks when you come in from a hike. So frustratingly, we see not a change, and we cannot and have not been able to bend the curve. It seems an increasing number of tick infection and tick-borne illnesses every year. Instead, what we see that in states such as Ohio, where until a few years ago we really saw very little tick activity, we now see this increasing number of, for example, Lyme disease. And it's unlikely that this trend is going to change. Of course, a changing climate, a warming climate is expanding the ticks northwards who are now able to overwinter in areas further north and at higher altitudes. And that is a driver, but it's not the only driver. There are other changes that I can think of, for example, change in land use and individuals moving into more forested areas. But there's also change in biodiversity and with certain species thriving. And I'm thinking here of the white-footed mouse, which we know is a preferred host for the bug that causes Lyme disease, Borrelia burgdorferi. So a phase 3 clinical trial for a Lyme disease vaccine was just completed, and the early data suggest quite promising results. However, this vaccine has design challenges. It is a transmission blocker only. And of course, this vaccine requires 3 shots plus a yearly booster. And so it's unlikely that the broad communities, all but the most enthusiastic outdoors people, are going to pick up this and have this vaccine given to them. So, and even if this vaccine were to work perfectly and everybody is taking it up, it of course does not prevent infection from other tick-borne illnesses. I'm thinking about babesiosis, an increasing disease of a small parasite that infects red blood cells and threatens the safety of our blood supply, or the alpha-gal syndrome, an allergic reaction to eating red meat, where we get sensitized through the bite of a tick called an amblyoma tick or the Lone Star tick. this tick in particular is moving very aggressively north. So for example, in Maryland here, it is now the most commonly found tick when we go out and collect ticks. So this increasing threat caused by tick-borne illnesses must urgently be addressed by comprehensive public health measures and research and approaches to prevent tick bites from happening.
Thank you, Professor Baumgart. Now a question for Professor Hart. Are you seeing more cases of tick-borne diseases this year? And if so, why?
Yeah, so we are seeing a lot of ticks so far this year, and with more ticks comes more tick-borne disease. So the CDC estimates that we have about 500,000 cases of Lyme disease annually, and we're normally seeing more and more Lyme disease cases every year. So this year, we've already seen 25% more hospital visits for tick bites in April than we did by this time last year. And this doesn't include visits to urgent cares or to primary caregiver, primary doctors. And so while this year isn't over, so we can't definitively say it'll be worse than last year, this spring at least has been worse so far. So definitely it's a big year for ticks and a big year for tick-borne diseases. This increase in tick populations is going to be caused primarily by climate change. So things like warmer, milder winters are great for ticks to survive to the next year without freezing. And it also helps the animals that the ticks feed on, deer and mice, survive at greater populations, giving ticks more food to feed on and more ticks on which, or more food on which they can grow their population. And then also the increased volatility that comes along with climate change can help the already booming tick population survive as well. And so it might be counterintuitive, but even when there are colder winters, so for example, on the East Coast last year, the increased snowfall that comes along with that can provide a more insulated cover under which ticks can stay warm, sort of acting like an igloo. So just the cold snow still can insulate from the cold air. And so all this just means that more ticks can survive winters into spring. And then with no shortage of tick food, the populations can continue to grow as well. That being said, even though there are these increasing tick populations, there are also steps we can take to prevent a tick bite. And so these steps are sort of at the, we can take them as individuals, in our household or in our communities and neighborhoods, and then also steps we're taking as scientists to prevent the tick bites and also prevent the spread of tick-borne diseases in ways that are proven to be effective. So as an individual, I would recommend wearing long pants and tuck them into your socks. It doesn't necessarily look cool, but it gives you a nice barrier between you and the tick so the tick can't bite. Wear light-colored clothing so you can easily see the tick and pluck it off before it bites. Use bug spray, and then you can also treat your clothes with a spray called permethrin, and this will help keep the ticks away, sort of like a mosquito. And when you come inside from doing high risk activities, so these are going to be things like hiking, golfing, gardening, do a thorough tick check and then shower immediately to wash off any ticks that might have sort of caught a ride. And so you want to look really well across your whole body. But if you think about how a tick would grab onto you, they're going to be searching for something to grab onto from tall grass. So you really want to pay special attention to where this tall grass would be coming into contact, and that's going to be below the waist. So look across your whole body, but pay special attention to your waistband, ankles, and really anywhere below the waist that would be coming into contact with that tall grass where ticks like to live. In your household and in your neighborhoods, you can try to make tick-free zones. So ticks love forest edges. So if you have a forest edge up to your yard or in your neighborhood, you can try to rim this edge with a couple of feet, 2 or 3 feet of mulch or gravel, just because this will be a difficult place for ticks to crawl through. You can also try to exclude tick hosts, so things like mice and deer. So just limit the number of rodents in the neighborhood or in your house and try to fence out deer so they can't bring the ticks in. And then you can also finally spray your lawn or your neighborhood as well. Many pest control companies will make formulations to spray for ticks, but also there's some work showing that spraying for mosquitoes might be effective against ticks as well. And then finally, what are we doing as scientists? We really are working diligently to try to develop new diagnostics and new treatments and new preventatives like vaccines to block the spread of tick-borne disease or to better treat people when they become infected.
Now we will take additional questions. A reminder, if you have a question, please enter in the Zoom chat with your name, media outlet question, and to whom you'd like to address your question. Let's start with a question for Professor Baumgart from Ian Sample with The Guardian. Can you talk about chronic Lyme disease? Is there such a condition, or can there be post-bacterial illness? What is the best info out there for people?
Yeah, the disease is real. I prefer to call it post-treatment Lyme disease syndrome because chronic Lyme has often been associated with an assumption that the bacteria are surviving the antibiotic treatment and that you have ongoing symptoms after you complete treatment because there are more bacteria causing the illness in your body. But we don't know the reasons of why certain individuals are having ongoing symptoms of disease after the complete antibiotic treatment. Clinical trials have not confirmed that continuous treating or higher doses of antibiotics and broad-spectrum antibiotics have brought any long-term symptom relief. The alternative mechanistic explanation of why some people suffer from ongoing symptoms after is that these bacteria causing Lyme disease have, over evolutionary time, learned to adapt to suppress the immune system. So it's possible that many of these symptoms that individuals experience are really an outcome of this alteration of the immune system. It is important to point out that the highest risk of having post-treatment Lyme disease syndrome is a delayed diagnosis. So having a stronger infection and therefore stronger responses from the immune system seem to be related.
Great, thank you. And here's a question also for you, Professor Bumgard, from freelance journalist Craig Miller. What are the odds for approval of the Pfizer vaccine and the most realistic date for it to hit the market?
Yes. Yeah, the early data look promising just based on the press release that they had. So assuming that the data are as good as they initially look or promising, the Pfizer is interested in preparing their paperwork to submit to the FDA. And the usual approval takes about 6 to 10 months. I know the FDA is looking forward to getting the paperwork. And of course, we have currently no other alternative. So if the vaccine is efficacious, as it looks like around 73, 75% at the height of protection, that would be very similar to what we saw in 1998 with the approval of a prior version of the same vaccine. So with that said, as early as the spring or early summer of next year, could see this vaccine on the market.
Great, thank you. Here's a question for Professor Hart from Jeva Lang at Heatmap News. Would love to hear how or if climate El Nino will impact the tick season this year and next.
Yeah, so with El Nino is going to come milder winters. In the US specifically, it'll be drier and milder winters in the north and then wetter winters in the south as well. So with the warmer winters or the wetter winters, that'll typically mean more ticks surviving into the spring. So ticks are going to like high humidity, and they're also going to like to not freeze. So we can see a more intense or possibly earlier tick season. However, when we look at places that will have drier winters, that could negatively impact the tick population just because, like they said, they're going to like the high humidity and the high precipitation. So that can lead to a little more of an unpredictable tick season. Really, overall, though, I think that unpredictability sort of highlights our need to keep a track of tick populations throughout El Nino, and us as scientists and health authorities as well, and the government to collect more data so we can be the best prepared moving forward. With ticks, basically, they want it warm, they want it humid, but they don't want it hot. And so with El Nino, in many cases, we should see an increase in tick populations, and then in other places, we will just have to wait and see.
Great, thank you. For you, Professor Bumgart, a question from Jenny Blair at Medscape. Any new information on the range of ticks bearing Powassan or alpha-gal?
Yeah, Powassan virus is carried by Exodus ticks, the same tick that are causing Lyme disease. So it's very broadly spread over the Atlantic at the Midwest region. And then, of course, on the West Coast, a close cousin. There are very few of these ticks that actually carry Powassan virus when people are going out and measure that. and explaining the sporadic and rare nature of Powassan. Even though it is a very scary disease, we haven't seen any changes in this very low infection rate of the ticks, and therefore explaining a low rate of humans getting infected. That is very different for the tick that causes the alpha-gal syndrome, or we believe causes the alpha-gal syndrome, and that is the amblyomma tick or the Lone Star tick. This tick is aggressively moving north. It's really taking over. When we go out and collect ticks, we're now seeing this tick more and more, perhaps explaining the increases in patients having alpha-gal syndrome that we seem to be seeing.
Great. Great, thank you. Here's a question from Sarah Bowden at CIDRAP News for Professor Hart. When you said you're seeing more Lyme disease cases this spring, were you referring to your own clinic or national and/or state data?
No, so I don't have a clinic. I'm a PhD, not an MD. I was referring to data from the CDC on tick bites. So on people going to emergency departments with a tick bite. And that was just published on the CDC.
Great. Okay. Thank you. Another question for you, Professor Hart, from Jeremy Pichari with the Magnolia Tribune in Mississippi. How would any of these changes affect residents in states like Mississippi?
Sure. Yeah. So I'm from South Carolina, so I have similar concerns about ticks in the South and in the Southeast. So basically, ticks are spreading pretty much across the country. And in the South, we're seeing an expansion in ticks as well. Luckily, there's less Lyme disease in the South. But unfortunately, we do have diseases like Rocky Mountain spotted fever and ehrlichiosis that we have to keep an eye out for. So these are going to start with like pretty much all the other tick-borne diseases, sort of flu-like illnesses, and a localized rash. But then these can also spread to cause a more widespread rash, muscle aches, fatigue, nausea, and then in the case of spotted fevers, even gangrene. So it's important to still keep an eye out for ticks and to go to the doctor if you are bitten by a tick.
Great, thank you. And from Apollonia Adeyemi with the New Telegraph in Nigeria for Professor Baumgart, what are the drivers of these diseases, or how common are they in the African region, if at all?
Yes, we have much less information about Africa, but tick activity is high in certain African countries, in particular in the northern parts of Africa, and there's some data available from West Africa. Serological studies suggest that diseases such as rickettsiosis and ehrlichiosis are common. Actually, the second most common recurrent fevers after malaria is the African tick bite fever that is sometimes diagnosed when visitors to Africa come back home. Unfortunately, the diagnostics are very poor. There's very little diagnosis of tick-borne illnesses done, and more effort has been done on understanding how these diseases affect livestock. Livestock is often a source of a blood meal for these ticks, and this livestock can be quite severely affected. And if the tick burden is very high, they can become anemic, which of course has devastating consequences for the owner of these. So overall, definitely tick activity, definitely diseases, but the numbers are just not easy to come by, and so we don't understand enough about it.
Great, thank you. Here's a question from Lori Johnson with Christian Broadcasting Network for Professor Hart. How do tick-borne diseases affect the brain?
Yes, so pretty much every tick-borne disease can cause things like fatigue and headaches, especially upon early infection. Lyme disease can cause what's known as neuroborreliosis, or symptoms in the central nervous system, like palsy or brain fog or nerve pain. Though I should note that these symptoms are going to be less common than Lyme arthritis and other Lyme disease symptoms. Other diseases, though more rare, like Powassan virus, actually specifically infect the brain. So they can cause things like meningitis and require more prompt treatment to avoid or try to lessen some of the long-term complications. So lots of ways they can impact the brain, some more common than others.
Great, thank you. For Professor Baumgart, a question from Lynn Peterson at Trends in Medicine. What does this mean for fruit and vegetable farm workers? I have a friend who has low height blueberry fields, and there are lots of ticks in the fields.
Yeah, farm workers are very are amongst the most affected workers. So I would definitely recommend if this Lyme disease vaccine becomes available, that this might be a population that could really benefit. Overall, just being really careful and checking yourself every night when you come in from work, taking a hot shower. Check the areas that ticks like to be. It is really important to check daily for exposure to ticks and for tick bites and to collect these ticks. The good news about the one good news we have about Lyme disease that it takes about 48 hours between the bug is transferred from the tick to the human after the tick bite starts. So you have some time. So if you're vigilant and pick these tick up every evening, you will be safe, at least from Lyme disease, even if you find a tick has already bit.
Great. Thank you so much for you, Professor Bumgart. A question from Phil Yakubuski at WBAL. I was hospitalized last year for 5 days for a severe Lyme infection. It gave me arthritis in my left knee, treated with ceftriaxone. Curious if there's a move to jump to the doxycycline immediately to wipe out the Lyme. Also, would the vaccine work on someone like me who's already been infected and treated?
Yeah, so I'm not an MD, so I wouldn't make any recommendation for treatment. But of course, these two antibiotics, ceftriaxone and doxycycline, are the two that people are treated with. They're both broad spectrum antibiotics and should work. In terms of the vaccine, it should not make any difference for you having had Lyme disease. The vaccine actually works. It induces an immune response, again, a part of the bug, Borrelia burgdorferi, that isn't usually seen by the human. It is a little piece of the Borrelia that is only exposed in the tick. So the way it works is that you make antibody to this piece, and then as the tick is picking up the blood meal, it takes up the antibodies to it, and so it prevents the bug from ever making it into your body. So it is possible that you may have residual immunity from having had Lyme disease. So the combination of that residual immunity together with this transmission blocker may actually work well.
Great, thank you. Several questions from Emma Cameron at ABC7 Chicago for Professor Hart. For viewers in the Midwest, especially around Chicago, are you seeing an increase in ticks and tick-borne illnesses in areas where doctors may not be used to diagnosing them? And given that Lyme disease and alpha-gal are treated by different specialties, how can patients make sure they're not slipping through the cracks if their symptoms aren't immediately recognized?
Sure, yeah. So tick-borne diseases have definitely taken a hold in the Midwest, especially in sort of the Great Lakes states, northern Midwest. And so we're seeing it around Chicago, getting down there as well. Um, this can make diagnosis tricky just because if you're sort of at the outer boundaries of that tick-borne disease range, it is important to stay aware of what diseases are coming into your area and what the symptoms look like. However, I would also say to um, try to trust your doctors as well. So they are trained in how to stay informed as disease trends in the area. So I'd recommend, you're going to be your best advocate. So I'd recommend staying informed from trusted sources, but also trusting your doctor and advocating for yourself with them. So if you know you've been bitten by a tick, it's best to be just upfront with your doctor. If you're concerned about tick-borne diseases, just let them know, and the two of you can work together on a treatment plan together. In terms of the differences between Lyme disease and alpha-gal, so Lyme disease is going to be a bacteria that's actually transmitted by a black-legged tick or an Ixodes tick. The bacteria infection is going to be what causes the symptoms of Lyme disease, whereas alpha-gal syndrome is actually it's an allergy against a sugar that the ticks produce, a sugar that's also in red meats, and a sugar that we don't have. So when you're bitten by a tick, you can become allergic to this alpha-gal sugar. And so then when you eat red meat or other meat that contains alpha-gal, you can actually begin to have an allergic response after a few hours. So things like gastrointestinal distress, hives, or even anaphylaxis. So different doctors will treat these, but I think it's going to be best to start with your primary healthcare provider. Let them know you've been bitten by a tick, you're concerned about these symptoms, and so they would know sort of the best step forward because maybe you do need a treatment with doxycycline, or maybe you need to go to see an allergist or somebody like that as well.
Great, thank you. For Professor Baumgart, why are misdiagnoses of tick-borne diseases so common? What can be done to remedy this?
Yeah, unfortunately, many of the tick-borne illnesses start with very non-specific symptoms. We call them flu-like illnesses. So you might run a slight temperature, you feel fatigued, but there isn't really anything that allows you to differentiate one disease from the other. With Lyme disease, if you're one of the 70% of individuals or so that develops a skin rash, that is often the most prognostic for actually having had Lyme disease. And the diagnostics that we currently have are really not great. And they don't work at the point of care, so they are not giving you an immediate answer. So often the doctor will treat with a broad spectrum antibiotic, thinking it might be Lyme and hoping that if it's not, that the antibiotic will work. So unfortunately, we don't have the high quality diagnostics that we would need to be able to help the doctor make these decisions because the symptoms are just not specific enough.
Great, thank you. And here's another question from Sarah Bowden at CIDREP News for Professor Hart. Has anything this tick season surprised you? New regions where ticks are present, who is getting sick, how the disease is manifesting, etc.?
No, I wouldn't say any of it has been a surprise. Uh, it's been reported pretty consistently, just a steady increase in tick ranges and a steady increase in tick populations and tick-borne disease throughout the past couple of decades. So I wouldn't say any of it's surprising, but it is an unfortunate trend we continue to see. I say an increase throughout the past couple of decades, there's year-to-year variation and things like that. But overall, if you look 2000 to now, you just see a steady increase in the number of tick-borne diseases.
Great. And here's the last question from Lynn Peterson at Trends in Medicine for Professor Baumgart. Do you need to go to the doctor for every tick bite?
Yeah, that's a really good question. It really depends on your doctor. What I would suggest is that you pull out the tick, and if you can, put it in a Ziploc bag and put it in your freezer, the only way to kill a tick. And so you have it available in case you do develop symptoms. Now, if you live in an endemic area for Lyme disease, I would suggest you seek your doctor because a short course of antibiotics would be indicated if that tick had been on you for 36 hours or more.
Great. Thank you both for answering all the questions. We will now take a few minutes to share brief closing remarks. Professor Baumgart, please go ahead.
Thank you. Yeah, so the common sense methods of checking yourself for ticks can be highly effective when implemented correctly. It is the only thing we currently have, but it can be highly effective. Yet we need more comprehensive measures to really bend the curve of tick-borne illnesses. We must support and if possibly enhance the efforts by the CDC with the individual health department in each state to collect data on the tick population and the number and types of human tick-borne illnesses. The Health and Human Services Administration recently put a limelight on post-treatment Lyme disease syndrome, and that is very important because we have too many individuals in this country currently suffering from the long-term consequences of having had Lyme disease. However, we cannot treat ourselves out of this public health crisis. We must develop a comprehensive strategy that is from research and development into better approaches for prophylaxis, protecting us from Lyme disease, but also more broadly helping us develop an anti-tick vaccine that can protect from all tick-borne illnesses. We must develop better diagnostics because the highest risk factor of getting PTLDS is a delayed diagnosis. So only when we have such a comprehensive approach will we be able to finally bend this curve of an ever-increasing number of tick-borne illnesses.
Great, thank you. Professor Hart, please go ahead.
Yeah, so while the increase in tick-borne diseases and the spreading tick populations can be a little frightening and a little concerning, I do just want to reiterate that there are steps that we can take, and many of the steps Nicole mentioned, to prevent the tick bite in the first place, to prevent the tick-borne disease. So again, as an individual, wear light-colored clothing, tuck your pants into your socks, especially if you're golfing, hiking, gardening, and doing things where you're going to be outdoors in this tall grass. Use bug spray or permethrin-treated clothing, and really stick to the trails and stay out of the tall grass where possible. It was actually shown that in the late 90s, at least, your golf handicap was correlated with your rate of tick-borne diseases. So if you had a handicap over 100, then you were, or if you're typically shooting over 100, then you saw a higher rate of tick-borne diseases. And basically that just means you would be in the tall grass and the rough more looking for the ball. So that just sort of goes to reiterate, or if you could stay out of the tall grass, you can sort of stay off of, you can keep away from tick-borne diseases. When you come inside, do a regular tick check and then shower after these activities. Make your tick-free zones with mulch or gravel, or use fences to limit, to exclude deer and limit rodents. And then as scientists, like Nicole mentioned, we're working diligently to develop more sensitive diagnostics, better treatments or more specific treatments. And then with these new vaccines on the horizon, hopefully we'll be able to limit the tick-borne disease burdens in this country shortly.
Thank you both for your insightful answers. We will email the links to the resources mentioned today and share it in the chat. And with that, I'd like to say thank you again to everyone for joining us today. A link to this recording and an unofficial transcript will be provided later today.
Thank you, Anne.
Thanks, everyone.